Now, the media has been called upon to lend its voice in amplifying the need for the implementation of the Discrimination Against Persons with Disability Act and the National Policy on Sexual and Reproductive Health for People with Disabilities, with emphasis on women and girls. The call was made during a media roundtable discussion organized to orientate journalists on the need for inclusive reporting relating to sexual and reproductive health on people with disabilities. Correspondent Lois Abasambo has the details.
The enactment of the Discrimination Against Persons with Disabilities Act has gone a long way in making sure that people with disabilities are not discriminated against. However, there still remains a lot to be done in putting effective measures in place for its full implementation. Project Manager and Executive Director, Survive Fistula Healthcare Foundation, Mrs. Peters Ogumain, highlighted the need for more awareness in the grassroots for the implementation of the Act. She said the lack of awareness of the policy in rural areas has greatly contributed to its slow implementation.
We have like 3, 4, 5, 6, 7 objectives, but the most important there is the creating awareness to the public, especially to the policy makers. In looking at sexual and reproductive health issues with persons with disabilities and prevalence and incidence rates of obstetric fistula in Nigeria. Persons with disabilities, the document has been developed, no implementation, no domesticating it to the state or to the grassroots. The fistula issues are still there.
Mr. Agbo Christian Obiora said the media has a major role in amplifying the need to make public structures and vehicles accessible to people with disabilities. He also lamented the discrimination people with disabilities face daily.
First of all, you should not think that persons with disabilities deserve pity. You should not see persons with disabilities as people who are very violent. You should not see people with disabilities who are not productive. You should not see persons with disabilities as those who are less human. You should not see persons with disabilities who are very dependent. So these are very, very unfriendly perceptions that people have about persons with disabilities. And in fact, what we need to be doing is that let's begin to look out for those potentials that persons with disabilities have. Let's first of all look at the person before looking at the disability.
Speaking on the National Policy on Sexual and Reproductive Health for People with Disabilities, Mr. Noel Balogun Samuel said there is a need to intensify sensitization on the National Policy on Sexual and Reproductive Health for People with Disabilities, with emphasis on women and girls.
The media serves as a bridge between the government and the people, so it's important that the media is constantly giving feedback to the people on whatever information that they gather from the services that I've mentioned. So also the media can play the role of telling human interest stories. Human interest stories as what was the case of women with disabilities before the policy was launched and now that the policy has been launched.
Some beneficiaries of the Survive Fistula Healthcare Foundation share their experiences.
After 1 week of the CSA, I was noticing some things. If my husband was buying a pap, I taken it, I will see the pap throwing from where? Yeah, throwing pap through my private pipe. So we went to Wali Hospital. We meet these people. We meet them. That's CBN. We meet them. Immediately we meet them. They admit us and they operate me, repair what the man that's going. They repair now. Since that time, I did not notice anything again.
SFHF. They now picked up from there. They paid for my antenatal and my delivery through cesarean section. In fact, these people are wonderful. They are awesome.
It is 3 years into the 5-year transitory period stipulated for modifying public buildings, structures and automobiles, making them accessible and usable for people with disabilities. However, there is a lot of work to be done, hence the need for the government, civil society organizations and media to accelerate the sensitization on the need for implementation. Lois Apasambu, ASO Television News.